Hello everybody, I'm Greg Stock. I'm the CEO of Thibodaux Regional Health System. It's a pleasure today to introduce Dr. Dalmau, gastroenterologist, very well trained, very nice person. Some of you probably know her because her and her husband have a restaurant here in town, but we're really pleased that she has become engaged with us, employee of Thibodaux Regional, and we thought it'd be nice today to talk with you just a little bit and get to know you better and let everybody get to know you better.
Thank you so much.
Tell us where you were raised.
I am born and raised in Baton Rouge, but we've been living in Thibodaux now for almost 14 years.
Yeah.
Raising our children here. Our children are from here.
And how many kids do you have?
I have 2 children. I have a going into freshman and going into junior year at Edie White.
You don't seem old enough to me to have kids
thanks.
that old.
I appreciate that.
So, born and raised in Baton Rouge and medical school and residency and fellowship?
I am LSU through and through. Went to LSU for undergrad and went to LSU for both medical school, residency, and fellowship.
Great. It's a lot of training.
A lot of training, yes.
How many years was your GI fellowship?
3 years of GI fellowship.
Yeah.
I did 4 years of residency, so after medical school it was 7 years.
7 years after 4 years of medical school. It's a lot.
Really excited to now be in practice here in Thibodaux. I have a deep passion for preventing colon cancer. It's one of my biggest missions, and I think we'll be having some other talks on here in March because March is Colon Cancer Awareness Month. So that's my biggest passion, but in GI, we treat lots of things. We treat reflux, belly pain, all kinds of stuff, constipation, diarrhea, all kinds of stuff that I'm sure you don't want to talk about today.
Yeah.
But we can offer lots of help to lots of patients who have lots of discomfort and issues.
That's a critical thing, as a matter of fact. And cancer patients, you mentioned, our cancer program here has grown unbelievably, but some colon cancer is still one of the big ones.
It is. The biggest issue with colon cancer is that it's one of the only cancers we can actually prevent. So a lot of the things that we do in medicine now is geared toward early detection, such as mammograms, but we don't actually prevent breast cancer by doing a mammogram, whereas by doing a colonoscopy, we can prevent colon cancer by taking the polyps off first, which is why I'm so passionate about it.
It's awesome. It's awesome. So to live a healthy lifestyle to prevent the bad effects, very bad effects of cancer, you need to see your GI doc.
Absolutely.
And I don't have those recommendations on the tip of my tongue, but it's 40 years old, I think.
It's 45. So
45.
If you have no family history and you yourself don't have a history of polyps, we start training at 45. But it's earlier for people who have a family history of colon cancer or large polyps.
Gotcha. How can people find you? Where are you located?
So we have a new clinic at Thibodaux Regional. So we have a group, not only just me, and we are available through the hospital. We can be contacted that way. Our office is in the medical office building on the 4th floor.
Very good. Once again, it's a pleasure to have you here.
Thank you so much. I'm very excited to be here.